Today, I can announce that Pharmac has signed an advance purchase agreement for 60,000 courses of Pfizer's oral antiviral treatment, which is now subject to MedSafe approval. While only early and interim data has been released, clinical trials have shown this treatment is shaping up to be particularly promising, with an 89% reduction in hospitalisation and death. In simple terms, this drug, taken orally over the course of a few days, is the first of its kind to really hone in on coronavirus and can be taken at the first sign of symptoms to help stop people from getting really unwell. It's a big step forward for the management of COVID-19 globally. I know many of you may be interested in some of the clinical trials and other elements of this purchase. So Dr. Bloomfield, Dr. Ian Town and Sarah Fitt from Pharmac will be providing a briefing at the end of this week. That will also be live streamed. This is our second advance purchase agreement for an oral antiviral to treat mild to moderate cases of COVID-19, with an agreement for 60,000 courses of Molnupiravir signed in October. And that brings our suite of COVID medicines secured and managed by Pharmac to 6 in total, 3 of which are already in use in our hospitals, and the rest of which, subject to MedSafe approval, will arrive in New Zealand early in the new year. Alongside vaccinations, our hospital treatments are already reducing the likelihood of people needing ICU care. And for a range of factors, the ICU rate in Auckland has dropped to 3% of hospitalisations, down from the 5.7% that we saw earlier on in the pandemic. We've made sure Pharmac can continue to secure early access to new and promising COVID medicines as soon as possible, with $175 million allocated for medicines and supply chain costs, and another $300 million available for purchasing more COVID-19 therapeutics. Treatments are but only one part of our plan. We must continue with all the other elements of our strategy to manage COVID-19, like, for instance, contact tracing and testing. And here's another good reason why. Pfizer's new antiviral has a 3 to 5 day window from the beginning of COVID symptoms to be effective, most effective from 3 days, but still with efficacy up to 5. So while the drug will work for people early on in their illness, they may have already been sick for a day or two, which is why we need to maintain an effective contact tracing, testing and clinical assessment regime to make sure that we reach people in a timely way so these drugs can really have their full benefit. But of course, preventing people from getting COVID in the first place through vaccination and safety nets built into the traffic light system is still the very best protection we can offer. We don't want to wait till people are unwell and then treat them. Per capita, New Zealand maintains the lowest number of cases and deaths in the OECD, and they're well below other countries too. Our total case numbers sit at a total of about 12,000, the lowest in all of the 38 countries of the OECD. Next up is Iceland at 18,000, 90,000 in Luxembourg, and then all other countries come in at hundreds of thousands, then millions, peaking at nearly 50 million in the US. On deaths, well, of course, every single one of our 44 deaths is obviously an absolute tragedy, what we would rather have prevented. So too are the 880 in Luxembourg, the 2,000 in Australia, and the 788,000 in the United States. And even right down to the local level, we see the success of our cautious approach. In the past week, across the northern DHBs, which include the 3 Auckland DHBs in Northland, there were 432 fewer cases and 70 fewer hospitalisations than has been projected. That demonstrates that vaccines are working. But we know with the transmissibility of Delta that we will have more cases in our communities and more people recovering at home. And so we must be as prepared as possible to support all of those individuals to get well soon. And so treatments are another way we can keep people safe and ensure that our hospitals maintain capacity. Finally, an update on vaccination projections. As we move forward and look to review the traffic lights on Monday, the 13th of December, and the Auckland boundary eases on Wednesday, the 15th of December, we move forward as a highly vaccinated population. 88% of our eligible population is now fully vaccinated, and 93% have had their first dose. We have some new projections that I wanted to share today. As a nation, we are projected to hit 90% double dose on the 14th or 15th of December as the Auckland boundary changes. all Auckland DHBs are projected to hit 90% by the 15th of December also. My message finally then is simple. We are in a system that relies on a good spread of vaccination, and we have achieved that. But every percentage point helps, which means every vaccination helps. So if you're due for your second dose, please get it this week. If you haven't yet had your first, please talk to someone who has. Reach out. Make sure you're having your questions answered. It's the number one thing you can do to help make sure we have a safe Christmas and summer for you and your loved ones.